In the self-medication package I was talking about, we will be giving you plain Tylenol and Advil, as long as you're allowed to have them, no allergies. And we recommend that you take them to keep yourself comfortable. Your healthcare provider or the person who's delivering you will go over some of the information about the medication. At any time you feel that it is not making you comfortable or you feel like it's making you or baby drowsy, contact your healthcare provider to come up with an alternative. So cesarean sections, talk a bit about recovery here. With a vaginal delivery, we talk about after we put baby up skin to skin, and we plan to have breastfeeding started in the first hour after delivery. Same with cesarean sections. We do encourage skin to skin after delivery, not necessarily with the birthing parent, but with their partner. The partner can, keep baby nice and cozy on their chest until the surgery's done. But once surgery's done, the baby will go on to the birthing parent's chest for the moving through to the recovery room. Once in the recovery room, depending how comfortable the birthing parent is, we can start feeding within that same time frame, within a half hour to an hour after getting into recovery. So the timeline is a little bit different, but baby still has the same opportunities to get to the breast. Important for recovery is to get rest and make careful movements. With a cesarean section, there are more limitations in your activities after delivery. So for the first 6 weeks or until your healthcare provider says that it's okay, you're not to lift anything heavier than your baby. So baby in a car seat, no, you're not allowed to carry. But just baby, yes, you are. Climbing stairs within moderation, just because your abdominal muscles are impacted, it can be more uncomfortable if you're going up and down the stairs a lot. No running, jogging, jumping, or any other high energy activities. No sit-ups or other activities that cause strain to your abdominal muscles. Sexual intercourse is to be held off for the first 6 weeks, and driving, not necessarily the first 6 weeks, but definitely until your healthcare provider gives you the go-ahead. Again, that lower segment of the incision being low, just above the pubic hair line, it is going through the abdominal muscles. So sometimes with pain or just the muscles lacking in strength to react quickly can be an issue when driving. Not that we don't have enough obstacles with all the snow and ice already. But yeah, something to take into consideration. Remember, when you are at home as a new parent, you will be recovering from surgery. So you may need some extra help around and some support for the first few weeks. So let's just look at this little video and then we'll talk more about the incision.
Just like a vaginal birth, babies born by cesarean benefit from being placed skin to skin on mom's chest as soon as possible after birth. This helps stabilize the baby's heart rate, body temperature, and blood sugar. Ask your healthcare provider if placing your baby skin to skin after a cesarean birth is an option. If it isn't, placing your baby skin to skin with your partner or a support person is a great alternative. After the surgery is finished, the whole family reunites in the recovery room, where Louisa holds and breastfeeds her newborn.
I'm glad that we did skin to skin. She nursed right away. It's like maybe that moment of her being on my chest really did help her establish and want to nurse, and she nursed great from the very beginning.
Breastfeed as soon as possible after a cesarean birth. Breastfeeding is especially beneficial because the baby's suckling promotes uterine contractions and healing. Ask your nurse or lactation consultant about comfortable breastfeeding positions that you can use after a cesarean. For those who have a cesarean birth, it's important to remember that you just had major abdominal surgery. This is the day after surgery for Judith. She talks to the nurse about medication for the pain, and she stays in the hospital for 3 days.
Good. How's your pain?
It's okay.
It's okay. On a scale of 0 to 10, 10 being the worst, how would you rate it?
Right now it's at 0.
0.
I feel good.
Excellent.
Yeah.
Okay.
The nurse checks her incision and encourages her to do some light walking,
Looks great.
which helps the healing process.
The first day was a little bit challenging for me because I felt really nauseous as the medication wore off. And the nurses were coming in to give me pain meds if I needed it, and nausea meds if I needed it, and just to kind of see how I was doing and check on the incision to see how that was doing. And the second day I felt, even by that night, I felt so much better. And I could eat. And the next day I felt even better.
Once you're home, allow yourself enough time to heal. Keep your baby nearby because getting up and down for feedings can be painful and tiring. It can take 6 weeks or more before you feel up to doing your usual activities. So be patient and make sure you have lots of help.
How are you doing today?
I'm okay. It's a bit of a weird day.
Talk with your family and friends. Expressing your feelings will help you feel better. Many communities also have organized support groups for moms who have had cesareans. If you continue to feel depressed and negative, talk to your healthcare provider or a therapist.
There's an emotional process you go through just with various things. I mean, everything is sort of heightened. Mommy guilt and trying to balance, attention between two, especially when you're recovering from surgery. That was kind of a huge thing.
If a cesarean becomes a necessity, it can still be a family-centered experience filled with love and joy.
Okay, so keeping the incision itself to prevent infection, it is important to keep it clean and dry. So if you notice any signs of infection, you need to see your healthcare provider as soon as possible. So signs of infection are redness, pain, foul-smelling discharge, or heat at the site of the incision. You could get a fever. That would be a sign that there could be an infection brewing. Vaginal discharge and or an increase in vaginal bleeding, nausea and vomiting, and a general feeling of just being unwell. So those are some of the signs of infection. As with a vaginal delivery, after a cesarean birth, you will need to be taking over-the-counter medications to keep you comfortable. Take the pain medications as recommended by your healthcare provider. It'll make it easier for you to care for yourself and for your baby. And it also helps with your milk coming in too, because if your body is too focused on the pain and healing, can't do everything at once. So it's important to make sure you are comfortable. Again, if you have any concerns about your medication, and if you feel it has any effect on baby, then definitely reach out to your healthcare provider. Okay, so after delivery supplies, so we will be giving you some disposable pads to use in the bed. We sort of make a big pad for you for after delivery once you get up to the washroom. And then there will be a peri bottle. But if you have your own, definitely feel free to bring yours. A lot of people are bringing their own these days. But if you don't have one, we will provide you with one that you can take home. The absorbent underwear, disposable ones, we do not carry. We have mesh underwear that we add pads to, but if you want to grab some of the Depends like pull-ons, they are very handy. They have great coverage, multiple sizes, so they fit everyone, and they're just easy for those even the first day after delivery. They are great. So if that is something you're interested in, then I would definitely look at it, because unfortunately we don't have any at the bedside. Ice packs is something else that will be used after delivery. Usually ice is used in the first 24 hours, and then you can switch to other options. At home, you can use a sitz bath, which is like a basin that you sit inside the toilet, so that when you sit on the toilet seat, your perineum and things can sit in this warm water. It's great for helping with healing, or if you're having discomfort, or even when sutures are starting to dry and the healing process, they can make things a little bit itchy. Just people find it a little bit soothing. So it might be something you're interested in. Remember that when you are choosing pads for your postpartum period, just make sure they don't have any special weaves in them. If you do end up with a laceration that's been repaired or an episiotomy, that weave can catch. So no weaves. They are making more postpartum supplies. And even the Depends, they make them as postpartum Depends, not as the urinary one. So some stores carry all options, some only carry some one or the other, but those are all things you can get from either Walmart, Costco, or your local shoppers. Okay, so pregnant person's postpartum physical warnings. So again, just to go over some of the things for signs of infection. So a fever of 38 degrees Celsius or higher, foul smelling vaginal discharge, an increase in uterine pain, and heavier bleeding. Heavier bleeding can be related, as we said before, to infection, but it also could be a postpartum hemorrhage. So keep track of how much bleeding is happening. If you are having pain or burning with urination, it could be a urinary tract infection. Again, you should get that checked out by your healthcare provider. Lump or a hard area or pain in your breast if your milk has come in, that can start off as like a clogged duct. Clogged ducts can get infected, so it is important to take care of them by emptying the breasts and making sure baby's feeding regularly to help that prevention of mastitis. Red, tender, or a painful area on your leg. So that's talking more about clots. So things you would look out for at home. Generally, they don't show up right away. And with a vaginal delivery, you're in the hospital for about 26 hours and then you're home. So when you are being discharged, the nurses will go over some of these things to look out for also. So you don't have to remember it all here, but just little things to start thinking about. So a DVT in the leg, so that deep vein thrombosis, a clot. The leg it would be in means that leg would be more swollen than your other leg. It'd be more red, usually more heated. The leg that's swollen would be the one that's painful. If you're experiencing that at all, and literally you're just looking down at both your legs, if one leg looks off from the other, it is important you get assessed as soon as possible, because that can be completely treated. If you at any point have any other concerns about your health, call your healthcare provider as soon as possible. And if concerned and it's after hours or weekends or holidays, then come to Emerge. Okay, so we've come to our first question period. So if you have any questions, feel free to add them to the chat. Just remember to add your email and or phone number, just in case I can't get to all of them. Just give me a moment and I'll pull them up here. Okay, so question is there still vaginal discharge in the weeks following a cesarean section? Yes, there is. And yes, you will go home wearing a pad. Some people find it is a little bit lighter, but for the majority of people, there is still bleeding, and it will go through that process of being brighter red to, lighter but brighter red to eventually turning more brown and then whitish to that discharge. And that is completely the normal progress, but it does happen with cesarean sections and vaginal deliveries. Question is, okay. Someone's asking about the sitz bath. It's an SITZ bath. And it's literally like a basin that sits on top of the toilet, shallow, that you can fill up with warm water. Some people like to use Epsom salts, things like that, as additives to the water, but plain water is absolutely fine too. The question is, can I refuse a catheter? I have negative experience with them and get UTIs very easily. Generally, you don't require a catheter unless you are getting an epidural. Generally, with an epidural, you can't feel your bladder getting full, which would be the main concern there. When your bladder gets full, it sort of impedes baby's ability to descend. And then with lots of contractions, it can cause damage to the bladder. So the Foley catheter that we would use would be one that goes in and stays until baby's closer to delivery, then it is removed. So it's not something that's going in and out often. The other option for some people who don't want an indwelling catheter are in and outs, which means where you put a catheter tube in, let it drain the bladder, then you take it out. With that option, yes, you are definitely at a higher risk of infections just because there are more of them happening. And again, that all depends on how long your labor is too. Otherwise, that is something you can definitely talk to your healthcare provider about. But it's something if you are planning an epidural, then you almost need to have just because you can't feel your bladder. But if you're planning a natural childbirth, no medication, then definitely, yeah, there would be no reason to use a Foley catheter at that point. Okay, I hope that helps. Other things to help prevent a UTI for some people, drinking cranberry juice, obviously drinking a good amount of fluids. Some people even take cranberry supplements, like in pill form, to just help increase the acidity of their urine. Is there anything we can do now to help us lessen? Oh, okay. Sorry, I'm reading this wrong. Okay, so is there anything we can do now to help lessen the pain and tearing postpartumly as pelvic physiotherapy? So you can definitely do Kegels and things to help strengthen your perineum. There are, you can do some stretching exercises too to help. But that is something you would need to talk to your healthcare provider about. Usually because that starts at a certain point in your pregnancy. But definitely talk to your healthcare provider about that. What else is there? At this point in time, there's a lot of pelvic floor, like physiotherapy. A lot of people do after to help get things back to pre-pregnancy state. But that would be the main one there. Kegels, and then there are stretching exercises you could do. But again, I would speak to your healthcare provider first, because from here, I don't know about anybody's your health background or what's going on with your pregnancy. Another question is, I've read a lot about tucks and a foam for numbing on pads, like the Frida brand. Yes, we see that often now. Are those products recommended? Um, Definitely, a lot of people find them helpful. If you've had, say, an episiotomy or a laceration that required a lot of suturing, then you might want to wait a few days until there's a bit of healing because the products can cause a bit of stinging and things when the laceration's still a little bit raw. So give it a couple of days of healing, then definitely yes, at home you can use those products. Tucks are good for helping with cleaning and things too. If you have a lot of hemorrhoids, they would be good for that also. The numbing foam on the pads, I know some people have used it. I'm not personally familiar with that, like for personal use, but I've heard people do like it. So if it comes in a kit or someone gifts it to you, you might like it. You might not. I think it's different for everyone. Okay, question is, should we call the provider if any one of these physical signs occur or all of them together? Uh, Definitely any individual sign I would talk to them about. Some of them in this list right here can be combined, but you might not have a fever, but you might have pain and burning with urination, which could be a urinary tract infection. So for your own comfort level, I would definitely get that assessed. Don't wait for things to get worse. Yeah, so any one of these individual points. Great questions. Thank you, everyone. Okay, so that was the end of the questions for now. So let's move on to the next part of our webinar here. So we're going to talk a bit about the baby blues and perinatal mood disorders. So, symptoms of the baby blues are mood changes, weepiness or sadness, anxiety, lack of concentration, feelings of dependency or inadequacy. The baby blues are experienced by most new parents. And if you get the blues, talk about your feelings and take care of yourself. Call your healthcare provider if the blues last longer than 3 weeks. So the baby blues are considered normal for the first 2 weeks after baby's born, generally because of all the hormonal changes from being pregnant to not pregnant anymore. So it takes a little bit for the body to settle out. Anything past those 2 weeks, definitely talk to your healthcare provider. And the baby blues are experienced by about 80% of new parents. So postpartum depression, the symptoms can vary across the board for many people. So excessive worrying and anxiety, persistent weepiness or sad mood, inability to sleep even when you're exhausted, difficulty concentrating, loss of interest in activities you used to enjoy, changes in appetite, thoughts about harming yourself or your baby. Hallucinations are rare, but they are sort of the extreme end of this, and you need to be assessed in the emergency room if you are having any hallucinations. Postpartum depression can run in families, so talk to female relatives, and you may be at higher risk if you have experienced depression, anxiety in the past. But remember, partners can also get the blues too. It's important to note that sometimes the birthing parent may be having some of these symptoms, but they don't notice them. It might be, a support person who's there or their partner that is noticing changes in their partner. So being aware of that, having open conversations is very important. The postpartum depression affects about 20% of the population postpartumly. And it can occur anytime in the first year after birth. So recognizing it can be something that might require counseling, it might require meds, but it definitely needs to be assessed if it is running past that 2 to 3 weeks after the baby blues. We have a quick video on postpartum depression here.
And baboons read in bunches, and llamas read dramas while eating their lunches.
Tiffany is married with 2 children, 2.5-year-old Saunders and 8-week-old Walker. Tiffany has a personal and family history of depression and struggled with postpartum depression after her first child was born. She has not experienced any depression with her second baby. This is her story.
Postpartum depression feels very overwhelming. You can't control it on your own. It consumes you. You have all these outside influences saying what a wonderful time this is, embrace it, and all these things people tell you, yet you have none of those feelings. And that feels horrible. I remember this feeling of just sinking and wanting to not be around and hide. You become a completely different person. You know, my husband kind of pointed out to me, you know, I think this is bigger than you can deal with on your own, and so you need to get help. It took about a year to recover from the postpartum depression. I ended up seeing a therapist weekly, and I also went on an antidepressant. The combination of the two seemed to work really well for me. The second time around, it's given me a second chance to embrace life, embrace them, and have more fun.
So the baby blues versus the perinatal mood disorder. So some of the new way of healthcare providers are looking at this now. It isn't just something that happens after pregnancy. Perinatal mood disorder is talking about the whole time during pregnancy until, you know, that year after delivery. So just recognizing that some of these things can show up earlier, like depression, anxiety in the pregnancy before it gets worse after. Or some people it comes up, before delivery, and then everything settles out. So it can be, again, very different for everyone. At any point in your pregnancy that you are having concerns or, noticing changes in your mood that you're not quite comfortable with, talk to your healthcare provider. It could be your obstetrician, your family doctor, and just, get it put out there and see what resources are available. So coming back to this, baby blues versus the perinatal mood disorder. So this occurs, as we said, in the first 2 to 5 days after giving birth, can last typically 2 to 3 weeks. And up to 80% of new mothers experience the baby blues. Perinatal mood disorder and the anxiety disorder can start anytime within the first year after birth, last longer than 2 weeks, and affects about 15 to 20% of new parents. It's a persistent and intense feelings. So protective factors is having a strong social support, access to prenatal and postpartum care, optimal physical health, positive birth experience, access to mental health services, effective coping skills, and healthy relationship satisfaction. So what to do in seeking support? So early identification and treatment is key. If it is severe, seek immediate medical attention. Know the risks, signs, and symptoms, as we've been discussing. Identify if you have, or you or someone in your family has had a history of depression and even postpartum depression. Perinatal mood and anxiety disorders are highly treatable and recovery outcomes are good. So share your feelings, speak to your healthcare provider, maintain physical health, and that includes nutrition, sleep. It's very important. Time for yourself. Talk therapy with support groups, other new parents, a psychotherapist, or a counselor, and medication if necessary. So calming down, recognizing that shaken baby is syndrome is something that does happen. You don't hear about it too often, but it comes from a frustration. And it's important that when you're having this frustration, to not shake your baby, put baby down, take a deep breath, count to 10, place your baby in their crib, and if you need to, leave the room for 10 to 15 minutes. If you need help, call a friend, a family member, or a parent hotline for emotional support. Being a new parent can, I guess, the first time, even for me, children challenge you in ways you never thought you would ever be challenged. I remember what my mom forewarned me about, things she never said, don't shake your baby, but she said, if you feel like you need to calm down, put baby down, even if baby's crying. She's like, it's better for you to walk away. Baby's crying, they're fine. And you take that moment to collect yourself and come back. And we've had to do that probably in many other situations, but whoever thought an infant could do that to you? So it is important to have people you can talk to if you're having a frustrating day. And remember, it's not just that, it's the accumulation of lack of sleep and, new routines, things like that. So just make sure you've got a good support, a good community around you to help. Because the support is always, it's a helpful factor, but it can be a very comforting factor too, just knowing you've got someone you can call. So mental health resources. So on york.ca, we've got the New Mother's Emotions. Again, most of these are available online, so it's not something you have to pick up. The Public Health Agency of Canada has a few regarding postpartum health. Perinatalwellbeing.ca has resources available too. CMHA.ca is another resource available through Markham Prenatal, has resources and things on the website for you to do your research with too. After delivery, if you feel you need to speak to social work, that is also a resource available after delivery. And even beforehand, you can speak to your healthcare provider and they can contact you with resources too while pregnant also. So healthy habits, getting and having support, finding ways to get sleep, nourishing yourself, and nurturing your relationship. So here's a quick video on support and healthy habits.
It's a good idea to line up help with meals and chores for the postpartum period before your baby is born. And don't hesitate to call on friends and family when you need help.
Did you bring us some food?
We did. Are you hungry?
Thank you.
Everybody
We need that.
hungry?
Thank you.
Yeah, if you'd like to come by with lasagna on Thursday, that'd be great.
I had a couple close friends who came over, hey, can I do your dishes? Can I get you anything? So having someone just to come over and fill my water bottle was a huge help.
My only sunshine, you make me happy when skies are...
Try to simplify your life by minimizing chores and other obligations so you can spend time on what matters most, your newborn.
My sunshine away.
Take care of yourself by eating healthy foods and staying hydrated. And most importantly, find ways to get enough sleep, such as taking naps when you can and going to bed earlier.
Things that I do to take care of myself are, taking a shower, eating. Definitely, that's something that's important that kind of forget if you're busy. Sleeping, whenever he sleeps, I do try to get in a nap.
There have been moments where I feel a little guilty. I don't clean up the kitchen. I don't do the laundry. I haven't really done anything except hold her and feed her and hang out.
Although it can be hard with a new baby, remember to make time to connect with your partner. Sharing your feelings and getting things out in the open can prevent problems from getting worse.
Well, you definitely have to realize that, the baby was created in love, and you have to keep that element alive. You have to do things differently. Getting that alone time, getting the time to just nurture one another, it takes a little bit more work now. So you just have to be willing to put that forward.
So healthy habits, one of the most important exercises you can do for the first 6 weeks with no restriction is walking. This weather makes it impossible pretty much to be outside, but getting to a mall early, maybe walking some laps and just doing little things to get out and about is important to do. With the first 6 weeks after delivery, there should be no swimming, no aerobics, running, unless you've been cleared by your healthcare provider. Let me see, where are we at now? So tips for partners. So take a class just for partners. Make sure you spend time with your newborn. Find something special to do with just you and your baby. Hold your baby skin to skin when you can, especially in those early hours too. It's very helpful. And if you are feeling left out, talk to your partner, because there's a whole change in roles for everybody. So sex after birth. So avoid having sex until you are completely healed, which is about 6 weeks. After delivery, your doctor will make an appointment for you to come and see them in the office at that 6-week mark to make sure everything has healed up well. Make sure you talk to each other about sexual intimacy. Until you are ready, find ways to connect, such as massage, cuddling, or taking walks together. Talk about changes in the way you feel about your body. Talk to your healthcare provider if you have questions. So simplifying your life. We heard that in the little video. So choose easy to prepare meals and make extra so that you have leftovers. Limit your outside obligations and make housework a low priority. Limit visitors who aren't helpful. Sometimes hard to do, but can always do. Make that to-do list and designate jobs to people who want to help. So a tip here is to pass around a meal sign-up sheet at your baby shower, because the most important thing for you to be doing is, taking care of you, spending time with your newborn. So how to prepare for baby's arrival. So there are a number of things you do need to do and the research of things. So car seat, and learn how to use it. Make sure that base is installed in your vehicle, if that's your plan. Have a nursery ready or baby sleep space ready, including like a crib, good flat, firm mattress, things like that. Have a diaper bag prepared, and recognize the diaper bag is something you are going to use for a number of years as ages and stages change. So having something that, either you or your partner can grab on the go, whoever's with baby at that point in time, and the contents of that bag will change as baby grows too. So in the beginning, yes, definitely you want to have the diapers and the wipes and a change of clothes and things like that for any major dirty diapers that might leak when you're out and around, extra receiving blankets, things you need for feeding, but also things for yourself, like a bottle of water, some snacks. Because sometimes, you know, you might be at the mall doing errands, but then, you know, baby needs to feed, so you have your space to go do that. But then it's a great time to get a few calories on board for you and make sure you are staying hydrated. Have baby clothes ready and laundered. So remember the unscented, gentle soaps for babies since their skin is a lot more sensitive than ours. Stock up on toiletries. So there's no running out of things in those first early days. Kleenexes, toilet paper, toothpaste, whatever you need. Have things stocked up. Freeze some meals ahead. So if you're a little bit in the nesting zone, but feeling like cooking, even cooking up something large and then the leftovers, just putting them into individual containers for quick grabs along the way. Stock up some groceries and pantry supplies before baby comes. Start looking for a doctor, healthcare provider for your baby. So if you have a family doctor, just make sure that they are aware that you will be bringing an infant to them. If you are looking for a pediatrician, they are definitely more difficult to find if your baby is completely healthy. Generally, they will take on unless you already have a child with a pediatrician, they will take on babies that may have had a stay in the NICU or maybe there were some complications that they want to follow up. So generally, it is the family doctor that is going to follow up baby. Child-proof your home and pet preparation. So start getting things ready. Whether you have a specific blanket that you want to bring to the hospital that you will take home to introduce to the pets before baby arrives. Maybe making sure that baby's space is clear of pets for the, you know, those, you know, first months. Some of the child proofing comes into, you know, location of the crib, looking at like the lines on blinds, you know, long curtains, little things like that, making sure chemicals are on the low side, or making sure they're all in one space so that there aren't things as baby moves through the stages that everything stays out of their way. Looking at plugs for electrical outlets, just little things like that to make sure baby will be safe is important. And then prepare yourself for new responsibilities. I think, well, you can only prepare yourself so much, but definitely talk to people about what they found was the biggest obstacles or, you know, the challenges for them. Reading books on, you know, and there's tons of information out there about people's experiences with a new baby. So definitely look into some things. Maybe some things will come up that you hadn't thought about. And then start putting together your support team so that those people that you can count on who will be there for the phone calls or to come visit and or be your extra set of hands when, say, maybe your partner has to go back to work or things like that. So start putting that together, especially getting through all of this weather we've been having. It'd be different once, you know, it's nice and spring and people can get out safely without ice everywhere. So definitely put together that support team. Okay, so we're coming into the next question period about symptoms of the baby blues, symptoms of perinatal mood and anxiety disorders, and how to prepare for baby's arrival. And again, if you have questions, feel free to add them to the chat and add your email and or cell number for anything that we don't get to. But it looks, oh, we've only got one question here right now, which is great. Okay, so what if one doesn't have a support team, are there services to provide support? So one great support that is offered through public health is the Healthy Babies, Healthy Children program. They offer a number of resources from the time baby is born till baby's about 5, 6 years old. Essentially preschool. So they have groups for new moms and babies. They have groups at early years centers where you can, as your child gets older, where you can bring them, meet up with other parents, with kids the same age, essentially. So it is something where you can go and start making some contacts and creating your own support group. If you are connected to any religious organizations, sometimes there are supports through that too. Yeah, those are your general ones. And then different, if you're breastfeeding, there's different support groups for parents, support groups for parents who have had multiples or C-sections. You might even find groups within your neighborhood, or if you live in a condo building, sometimes there are parents starting up these groups where it can be a meetup, like one day a week or even one day a month, where you get together with people and, have an activity that you can go do together. So look into those, or you can start your own group if you really wanted to, if you're an organizer. Just reaching out to other family, looking for people to visit or who are wanting to come visit, and spread them out during, times that you are going to be on your own. So it's a good way to find some other supports. But always let people know if you need help. It could be a friend that you've met from somewhere else, or someone from work, or from your, from your religious group, anything like that. Okay, question is there a general rule about how long to wait before allowing visitors to come? Thinking about newborns and immunity. Yeah, we are still in flu season. So RSV immunizations will be offered as a way of protecting baby. Generally, visitors, it's all your comfort level, but I would definitely, because we still are in the flu respiratory season, I would definitely make it clear that if people are not well, that delay the visit. You can send a picture on a phone or an email, but you don't want to risk baby getting sick from someone else coming. So anyone who's sick, I would say definitely no. You can also, when people come to visit and they are healthy, just encourage everyone to wash their hands before, because, if people come via transit or from their kids' daycare, you just want to make sure people's hands are clear of germs before they go touch baby. And no kissing baby on the mouth. They can kiss feet, things like that, especially if you have say younger nieces or nephews around, and kids love to give their new family members big wet kisses. Yeah, not recommended this time of year. So encourage that too, and just recognize and have those conversations about babies being new, and just what you're thinking of too. So talk to people about that ahead of time. But again, it's completely up to you. If you have grandparents that are willing and ready and want to be supports as soon as you get home, and they're completely healthy, then of course, if you're comfortable with that, and then there's no reason to hold back on visitors. But again, that has to be a conversation between, the birthing parent and their partner, because some days you may not feel like visitors, just being very transparent with each other about where you're at. If you really don't want any visitors, even if they're bringing food, they can come drop the food and go, because sometimes you've just had enough or you're just exhausted and you don't really want to be entertaining people. So it's an ongoing conversation for sure. Okay, all right, that's the end of questions for this section right now. But of course, if anything else comes up, feel free to add it to the chat. So we're moving on to our next section of the newborn's world. So we'll talk a bit about a number of topics here. So we're going to talk about baby senses. So remember, baby focuses best about 8 to 14 inches away from you. So having baby close and talking, they can focus on items that are up close. Contrast is best. But when they're this close and you're talking to them, they recognize your voice, your smell. It goes along with everything. So babies do recognize scent and smell. Skin to skin definitely introduces them to smells of food and comfort right off the bat. And any warm skin to skin options are always welcome. And babies love to hear your voice. So whether you are a singer or not, or if you love books, you can always, if you're running out of things to say, grab one of those baby books and just start reading to them. Start, listening to books, starting some bedtime routines and things like that. Whatever your interest is. It's a great way for baby to be familiar with your voice. And that's even now, like you can even do that at this point in time in the pregnancy. Baby hears your voice. It's just obviously through a water world, which will be a little different on the outside, but they do recognize voices. Skin to skin contact is promoted from the moment they are delivered. It helps stabilize baby's temperature, their breathing, their blood sugar levels, and it is very calming to baby. They're placing them on your chest. They can hear your heartbeat, which they've been hearing a heartbeat their whole growing in the pregnancy. And it also helps with breastfeeding initiation, but also helps with new parents recognizing some of the feeding cues too. So size at birth. So at delivery, there are measurements we do. We do the cots that we have our scales in the delivery rooms. We don't weigh babies face down. They are on their backs. A little different from this, but we do have individual scales like this for postpartum, similar, not quite like this. For measuring weight, obviously once baby's got a weight, don't forget to get your picture of baby's birth weight. There are some measurements that are done primarily by the pediatrician or the midwife that's had delivery. So they'll measure head circumference, baby's length. If there is an assisted delivery with a forceps or a vacuum, then the nurse will be doing some additional measurements, head circumference and a blood pressure, oxygen saturation or other ones we do, along with listening to baby's heart and breathing. And then the other one we add is baby's temperature. So temperature is taken with a temperature probe under the armpit to assess baby's temperature. So the normal temperature for a baby is 36.5 to 37.5 degrees Celsius. So it is important with a newborn to make sure they're not getting too cold or too hot. So rule of thumb for keeping a baby warm enough is, first off, skin to skin with some blankets on top. They will be wearing a diaper and a hat for the first little bit. But obviously, birthing parent, support people need to be able to sleep too. So when baby is wrapped, just think of whatever you're wearing plus one more layer is what baby's wearing. So if you are just sort of like wearing a light shirt with pajama bottoms, baby will need sort of like an undershirt with like a shirt and bottoms kind of thing. So just one more layer than what we're wearing. On the other swing of things, we don't want to overheat baby because then we get worried about SIDS, which I think we talk about more about next week, sudden infant death syndrome, where if you overheat babies, they tend to get very comfortable and forget to breathe. So it's important for them to be not too warm. Thermostat is recommended for baby's room and things to be kept at around 21 degrees Celsius, and that baby's wearing enough to make sure they're staying warm, but you're not overheating them. There are two medications that are given to baby after delivery. So there's the antibiotic ointment, erythromycin, and the vitamin K, which is an injection for baby. The ointment, let's start with that one. So the erythromycin ointment is given in baby's eyes. It's an ointment that just goes over top. It's to help prevent infections. It used to be a standard practice, but it is something you can opt out of if you wish. It's mandatory if there is any history of STIs, sexually transmitted infections, with the birthing parent. Because this antibiotic protects the newborn from infections caused by certain vaginal bacteria that can damage vision. So if there's absolutely none of that in your history, then it is something you can opt out of. You can definitely speak to your healthcare provider about that ahead of time, but it doesn't sting. Literally, it's an ointment. It looks a little funny going in, but as it sort of melts to baby's body temperature, it just looks like tears, and then it absorbs, and then it's done. Vitamin K is the first needle, not the birthday gift any baby wants, but it is an important shot that baby gets. Babies are not born with a proper clotting factor, so vitamin K is that we are giving them to prevent rare but dangerous bleeding disorders. So vitamin K is a universal precaution. It's seen across all around the world. Japan, England, United States, Canada, standard protection for baby. And it is highly recommended. If you have questions about it, you can always talk to the pediatrician or your healthcare provider, of course, prior to delivery. So as I said, we are in respiratory season. So RSV is a virus that is common, causing lung infections. What's going on with my throat? Often leading to cold-like symptoms. Pregnant individuals, infants, young children, and older adults are at higher risk for severe infections. So how can I protect my child? You can immunize your child, make sure you wash your hands frequently, keep baby away from people that are sick, which we were discussing, and disinfect common surfaces, kitchen, door handles, things like that if someone is sick. So what and how effective is Beyfortus? So Beyfortus is a one-time injection that has proven to be highly effective in preventing RSV-related lower respiratory infections. Beyfortus is proven to be safe for babies and young children in clinical trials. Most side effects are mild and last only a few days. So for more information about this, talk to your healthcare provider. The pediatrician will also after your delivery come and talk to you about the RSV, and if you're interested in having it administered to your baby before going home. It is something the postpartum nurses will do if it's what you want before you go home. So newborn's appearance. So there's some photos here. So yellowy, this jaundice color, even the whites of the eyes are a little bit yellow. Those are signs of jaundice. After a vaginal birth, the baby's head can be molded. So remember, baby has those two soft spots, one near the front, one near the back, that allows the baby's skull to shift as they make their way down through the birth canal. It's not always noticeable with babies with lots of hair, but definitely the molding shape is noticeable after delivery. It doesn't last long though. The head settles. Usually within even the first few hours you can see a difference, and by the next day the molding's barely noticeable. Just remember that those soft spots, just make sure you're careful around them when holding baby. This creamy substance is called vernix. It is the protective, sort of like a protective water layer for when they were living in that water world. So babies that are born a little bit, well, just newly into term, or they're just a little bit premature, will have a lot more of this cream on them, the vernix. But babies that are born term or even a little bit later, post dates, tend to have a lot less of it, like the baby over here that's that we were using for the molded head, seeing the shape of it. So it can differ between babies, but generally it's very good for them. Their skin will absorb it. Generally what would be left at around 40 weeks is you might find some vernix in their armpit creases or in the leg creases. It's pretty much the only place it's left. But again, it doesn't need to be wiped away. It absorbs. It's completely fine. Right. So bathing your newborn. So there has been a lot of change around this in the hospitals. Research is promoting delaying baby's first bath until they are over 24 hours old. So what is happening now is that more baths are happening at home. There is information on how to give baby baths. Your nurse can talk to you about. There's also resources in your discharge package if you have questions about that. But research is showing us that to help with baby's immunity and just for their health, it's better for them not to be bathed, to be left in the fluids longer than what used to be done. Because at one point it was like just a couple hours after birth they would wash baby, then it got pushed to 8 hours, and then it got pushed to, I think it was around 18 hours to 36 hours, depending on the baby. So yeah, then now research is promoting even longer now. So baths at the hospital are very rare. Just sort of just some tips around bathing baby. Definitely when you are getting ready to give baby their bath, make sure you've got everything you need at the bath side. You don't want to be running anywhere to grab anything, because we never want you to leave baby alone in a bath by themselves. Babies don't need a lot of washing. They don't get very dirty in these early days. So generally, hair needs to be washed once a week. Body bath, maybe 2 to 3 times a week. Though each day you can do like a sponge bath where you wipe them off under their chins, the diaper area, hands and things, to make sure like any spit up and things have been cleaned up. Of course, there's always, things that happen that change that, like a massive diaper explosion, you might, or while that's happening in the tub. So there's always, rules can change. But generally, that's where you're going to start. With a newborn's bath, you just want to make sure they're not going to get too cold either. So again, doesn't have to be a long bath. It's, you can wash the hair separate from the body. So have baby sort of swaddled, wash the hair, dry it off, and then do a body wash on baby for the first little bit. When you are drawing the bath, just ensure the temperature of the water is not too hot or too cold. Best way to check that is by putting your wrist in the water or your elbow. Your hands do too much. They aren't very sensitive, but using that soft skin near your elbow or on the wrist, you can definitely feel the difference. So if you put your wrist towards the bath water and it makes you go, ooh, that's cold, that is too cold for baby. Same thing, if you put your wrist in there and you're like, ooh, that was hot, it's too hot for baby. So just make sure the temperature is good. Have everything ready there so that you can give baby a nice quick bath. Can become sort of those bedtime routines also. But just have your towels, everything ready for baby. Lotioning and things after a bath, you can start a little bit of baby massage through the legs and things, just to help with baby calming and getting comfortable before bed. When you're using soap for baby, just remember it needs to be baby newborn soap. Again, they are milder, less chemically, less colors, less dye, right? So it is important to use baby-friendly things. When you're washing baby's face, use the face cloth, go in towards the nose and out towards the side of the eye first when you're cleaning the face. So do eyes first, making sure not to rub back across to introduce any germs or dirt to the eye. You just want to start at the inside of the eye, wipe out, new piece of cloth, again wipe out until the eyes area is clean, and then you can wash baby's face, nose, cheeks, chin, and everything, and get underneath to their neck. When they're spitting up and things, that tends to be where little bits get caught up, so it's a good spot to make sure you get clean. Once baby's clean, make sure the skin is nice and dry. Just like with the diaper, any wet skin folds in the neck. If they aren't dried properly, they're more likely to get a little bit of a rash, and you could get a bit of skin breakdown just because the moisture is getting held in all those creases around their neck. So it's a great bonding time. I'm sure there's grandparents that are more than happy to teach you about bathing, or maybe you've had experiences with nieces and nephews and you already are experienced with bathing. But it's a great bonding activity too. So on baby, you will see fine hair. This is called lanugo, and it can be on the shoulders, the back, the thighs. It can be everywhere. But it is very fine hair, and it does fall out in time. So there is absolutely nothing that needs to be done with that. Some other skin characteristics you might notice is milia. It's these little white pustules you'll see on the forehead, chin, nose area. Generally, it's due to the hormone changes as baby has been disconnected from the birthing parent. So they sometimes get some of these little pimply things. They don't need to be, we don't want you poking at them or breaking them. Just let them be. They come and then they go on their own. Newborn rash is a normal rash that we see on babies. It can show up in the first day, sometimes a day or two later, so you may be at home. At any point you see a rash that you might be concerned about, you're not sure if it's quote normal, definitely take a picture of it, because some rashes come and go so fast that by the time you get to see your healthcare provider, there's nothing there. So take some photos, so they can look them over and, reassure you or, let you know what it is exactly if you have any concerns. Okay, the next picture I'm going to show you is a vaginal discharge on a baby girl. Some baby girls get what's called pseudomenses, is like a small period, again because of hormonal regulations. But when parents see it, because sometimes they see it in the hospital, it can be quite alarming because not only is there discharge coming, but there's blood in it. And of course, that can be quite startling when you see your baby bleeding. So that's why we bring it up here, that this is normal. Again, it's hormonal changes, and it again will pass. For baby boys, circumcision is an option. So after reviewing the scientific evidence, the American Academy of Pediatrics found the health benefits of newborn male circumcision outweigh the risks, but the benefits are not great enough to be recommended that all babies are circumcised. So the final decision should still be left to the parents to make it in context with their religious, ethical, and cultural beliefs. So since COVID, circumcisions are not done at Michael Garron Hospital, but there are a list of resources of where you can get circumcisions done if that is something that you're looking at. There is also the circumcision clinic, which has a multitude of resources available. Toronto, I think as far as Peterborough, they have different areas for this. So circumcisions are done by 1 month old. Recommended that it is done within 4 to 14 days after birth to minimize bleeding and complications. Though sometimes the procedure can be done as early as 24 hours, but they definitely recommend that it's done before 1 month old. If you are interested in circumcision for your baby, let your postpartum nurse know, and they will give you the list of resources of places that will do the circumcisions. Okay, questions around the newborn's world, their senses, abilities, reflexes, appearances, the baths, newborn procedures, and circumcisions. I will just check the chat if there's any questions there. Let me see. Okay, no questions at this time. Oh, that's good question. So, are circumcisions covered by OHIP? And no, they are not, because they are not considered medically necessary. How much they are right now, I am not quite sure. And I think it would probably depend on who's doing it for you. If you're doing it at a clinic with anesthetic for baby and everything, yes, it'd be a little different than where it's done in other places. But if you look up the circumcision clinic, they do say that they do have online pricing and bookings available. So, and it's not something you need a referral for. It is, it's completely up to you to book on your own. Okay. Next question I've got here is how to avoid SIDS, and actually that is going to be something we cover next week in our topics. But generally, if you are looking for information, you can look online ahead of time, so we can talk about it more next week. But definitely, Public Health Agency of Canada, Toronto Public Health, they have resources available online if you want to start doing that. Because again, SIDS is they've now changed the wording a bit. It's SUIDS now, so sudden unexplained infant death syndrome. Because for most cases, still they don't know why it has happened. So either way, that is something we'll talk about next week. But if you want to look it up to start getting some information, we will talk about ways to prevent. And primarily it is the back to sleep program and that they have been running for years now, that baby should always sleep on their back to avoid suffocation, essentially. All right, so either way, we'll talk more about that next week. Okay, and that's it for questions right now. So let's move on with the content. We've got a little bit more to go and a half hour left here. So bowel movements for babies. So the first poos are called meconium. They are sticky, they're black. When they dry, they stick to the skin really strong. They get everywhere too. So if the baby gets a foot in it, the next thing you know, it's on another leg, it's on your hand, it just starts to spread everywhere. But no smell, nothing. It's just very sticky. As baby starts to feed more, whether it's bottle or breastfed, the poo will become more transitional, where it turns, from that black browny green to this greeny yellow color. And that is one of the normal transitions. By the time for a breastfed baby, it'll look mustardy yellow. Breastfed babies the poo looks more like Dijon mustard of the seedy variety, versus a formula-fed baby tends to look like Dijon mustard, but a little bit more solid, minus the seeds. It just, the breastfeeding poop is essentially, because of the breast milk, it's a natural laxative, so it does tend to be quite explosive. If you've seen any of those videos online of babies scaring dogs with their diaper rumbles, yes, that would be why. But that is completely normal transition. It does take a little bit before you start to see this, but by day 5, you'll be seeing a lot of these diapers every day. It's amazing what little bodies can produce. This resource here, Best Start Breastfeeding Chart, is something you'll see in postpartum. It is actually something I have every parent find on their phone as sort of a guideline. Next week we'll be using it as a resource to check for baby's dehydration. But this is for starting breastfeeding, what we expect to see. So there's a lot of information in this chart, which is fantastic. From day 1 to up to 3 weeks, what you're expecting in diapers, how baby's tummy size changes, just for those visuals. So how many wet, how many soiled diapers, baby's weight. So recognizing that baby should gain back their birth weight by 10 to 14 days. So it is a bit of a process in those first couple of weeks, because it is normal for babies to lose weight, but it does take them a bit of time to gain that back, which is completely normal. So if we're looking at baby here for their breastfeeding and their hydration, we want to see that in day 1, we expect to see 1 wet and at least 1 of these meconium diapers. By day 2, at least 2 wet diapers, up to 2 of those, and that's normal. Obviously, if a baby gives you more, great, no concerns. It's when we get less that we get concerned about dehydration and things. But recognizing colostrum is the starting food for baby, the first milk, but then it takes about 2 to 3 days for the milk to come in, where you'll have that heaviness of the breasts. And the feeding will be completely different. The milk itself is different. It's higher in fats, so it sustains baby longer than the colostrum feeds, which you might feel are they are usually every 2 to 3 hours, but then baby wants more all the time. But every time baby goes to the breast, it's giving your body the signal to make milk. And when the milk comes in, then hopefully baby will enjoy and get more rest, which will allow you a bit more rest too. With their growing spurts and that along the way, that'll change feeds too, because all of a sudden a baby that's been, letting you rest a bit at night, might be up all the time at night because they are growing and they're cluster feeding. So they're being a lot more demanding. So that will come and go through the weeks as baby grows. But the chart definitely gives you a visual of what you're looking for. So if you're at, say day 7, but you've only seen 3 wet diapers, maybe 1 poop, and you're like, this isn't, baby usually eats more than this. Then there's things you can do. That chart sort of helps you recognize that, oh yes, I should be seeing at least 6 of these wet diapers and at least 3 of these poopy diapers, but I haven't seen that yet. Start, encouraging baby to eat more often if they're a little bit sleepy. And even while they're on the breast, sort of compressing the breast to keep them actively sucking, little things like that. But as you go through this process, we have a breastfeeding clinic at Michael Garron Hospital that you just call. You'll get the number next week where you can, leave a message, and they'll book you an appointment time to come on their next day that they're in. So they're generally in 5 of the 7 days of the week. They're usually not in on Wednesdays and Sundays, but they're the rest of the days. And statutory holidays, they are closed for those days too. But otherwise, they are a great resource. Lactation consultants run them. Access to the pediatrician if necessary. If there's blood work that's required, they can sometimes do that there too. Or they might send you to the family and newborn clinic also. So they all work together. But anyway, a great chart. Part of the newborn screening that we do is looking at the stool and poop chart. So this is something you will be given as part of the Newborn Screening Ontario. So it is this chart they will give to you before you go home. So the normal color of poop is at the bottom there. That's what they want you to check every day for the first month to make sure baby is doing well. Abnormal poop are the first 6, where it's lacking color, the consistency is different, but essentially anything off color they want you to call. The number is on the form and everything, but it's all there, part of the poop check for the Newborn Screening Ontario. Part of the newborn screening is also we do a cardiac screening test and this blood work here, which is to test for disease that don't show outward symptoms but need immediate treatment. The testing is done and then it is sent to Ottawa for testing. And once they get results, they would let you know. But generally, no news is good news, that there's nothing wrong. And then they will ask for the information to be sent to baby's doctor. So it's important that if you have baby being seen by your family doctor, that make sure they have that information. They will ask for it just to make sure. At this time of doing the blood test, they will also do a jaundice test to make sure the levels are in a safe area before going home. If they were concerned about jaundice levels, then that might extend your stay until they make sure those levels are either decreasing or not getting any worse. They do an oxygen saturation test as part of the cardiac test. And this is done before you leave the hospital. So if you have a vaginal delivery, it'll be done at 24 hours or older. And that's for everyone. But if there's any issues, it might, like say with a jaundice test, it might delay your discharge home. Otherwise, it's the jaundice test that you wait for, because everything else will be done. But once that jaundice test comes back, then you are cleared to go. Hearing tests are not performed at Michael Garron Hospital anymore. Ever since COVID, it seems to be where everything changed at that point. So they are done at Surrey Place. You will be given the information to call them. They have many locations, and they will refer you to the one that's closest to where you live to make it as easy as possible. It is recommended that it is done within the first 2 weeks. But when you get home, call for the appointment. They'll try to get it done sooner than that. The reason why they test hearing is 3 out of every 1,000 babies are born deaf or with a severe hearing loss. Catching and treating hearing loss early can minimize related speech and language disorders. So it's an important part of babies' assessments. All right, we're at another question period. Does anyone have any questions? If you do, remember to add your cell number and or email address, just in case. Thank you. All right. All right. So question is, how do you extract the blood from a newborn? This person is stating they need to have blood work done from baby before they leave the hospital. So, okay, so the blood work we do for the newborn screening is done through a heel prick test. If there's any sugar tests that need to be done, we do it through a heel prick. If there's actual samples required from baby, then a nurse from the NICU will obtain those samples once the doctor has the order for it, and they will draw those samples if they're required to be sent to a lab or to whatever's required for those tests. But they will be done in the hospital. Depending what type of testing it is, it can be the nurses on the floor, but if it's anything like more extensive, then the NICU would do the blood draw, sorry. Okay, other question is, how do you know when to supplement with formula if you don't think the baby is feeding enough before being able to see a doctor or lactation consultant? So generally the chart I just showed you is one of the ways you would be able to assess if baby is eating enough. So generally we weigh baby before you leave at the 24-hour mark with all the other newborn screening. So any normal loss is 5% at 24 hours. If it is above that, then you would stay a little longer. We'd put a feeding plan into place. So supplementation might be required at that point until milk comes in, and some more regular visits, maybe just to check baby's weight to make sure weight gain is going up. So that would be one way. The other way, if the weight has been fine, say there's only 3% weight loss, then generally what goes into baby needs to come out. So again, counting those diapers, making sure they're nice and heavy with fluid. Those poopy diapers also, the fact that baby's eating well, waking up to eat every 2 to 3 hours, or you're waking baby to eat. Those are your best indicators at that point. At any point, though, you will be starting to see your family doctor or the pediatrician, whoever you have set up to see your baby, within 2 to 3 days after discharge. And that's when you'll start your regular checks with your baby's doctor. So you'll be going back frequently, or if you have concerns, you can always go to the office. The other resource you will be given around discharge is it's a walk-in clinic run by pediatricians down on the Danforth, and it's a evenings, weekends, and holiday clinic essentially. That well, they'll give you the card, and then you would, if you needed baby to be seen and you don't feel it's urgent, but you wanted a weight check or something, you could call them and have baby weighed. And if there was any concerns, then you could always go back to the hospital. But generally, if everything's going well, you would just continue on with your baby's follow-up appointments. Anytime in that, though, you can always call to be seen at the lactation or the breastfeeding clinic for lactation to assist with feeding. And again, if they feel supplementation is required, they will let you know. Also, baby will let us know sometimes that they want more until your milk comes in. But it's important to still put, if you're planning breastfeeding, to put baby to the breast. Okay. Okay, next question is where to get the hearing screen done. So the name of the place is called Surrey Place. The information will be given to you at discharge. They'll give you the number to call. So it's not something you need to worry about right now. But Surrey Place will let you know once they have your address what community location is closest for you to get to. Okay, and that's the end of the questions there. The questions. Oh, we're already okay. So we're at the, I thought we had a few more pages to go, but we don't. Okay, so if there are no other questions, then well, thank you for joining me this evening. Any questions that pop up, remember you have info@markhamprenatal.com. If anything comes up between today and the next group session next Thursday. But again, thank you for joining us. If you have any other questions, I'll stay on for another few minutes, but otherwise, this webinar is done for this evening. Thank you so much for all the great questions. And I'm actually teaching next week, so I will see you all then. Have a good evening. Good night.